Good afternoon, everyone. I'm Brenda LaChapelle. I think most of you know me. I just wanted to engage everyone a little bit in reference to the Jackson County Animal Shelter and the amount of change that's going on currently. We now have a millage, which is really good news, and I'm so happy that that's come to pass. With the current director of the shelter, I'm sure most of you know, or all of you know, that she'll be leaving. And she just started with us, I believe it was July. So, with that said, I would like to engage everyone in doing a little more research in reference to shelter management, shelter care, those types of things. And I've done some research. And there is a National Animal Care and Control Association. They've got guidelines for shelter operation, and I'd be glad to email that to everybody. It's a 65-page document, but it's all sectioned out into proper facility, proper housing, proper protocols, a lot of really good information that I think would benefit our county in the fact that the commissioners, we don't know what it really is to run a shelter ourselves, and maybe educate ourselves a little further on proper procedures and operation. Also, I've come across consultants at Cornell University in New York. They will come and do a site visit with us, and they do consultations on a full shelter evaluation and give recommendations of what it would take to run a shelter correctly, and like I said, with proper guidelines and those types of things. Also, Animal Control and Care is Citygate. It's a California organization, and they also do consultations and would come and do a consult and advise us on proper ways to handle the animal shelter. And then there's also capacity of care consultations, and they would also do consultations, and they would advise us on facility design, again, proper care, compassion overload with staff, proper hiring procedures, those types of things. So I've got these kinds of documents that I'd be glad to email anybody. And I'm basically just trying to bring to light that we really should research a little further into the operation of our animal shelter. Thank you so much.
Comments or questions? Just real quickly, you're more than welcome to email us with your information, but and you may have already talked to Deborah about this, but I think this is something maybe you should get with her, give her the information.
Point of order, Mr. Chairman. This is public comment, not a debate.
That is true. Forgive me. Yeah. Okay, we're down to minutes. Looking for a motion.
Second.
Okay. Any changes or comments or anything to the minutes? Okay. All those in favor, someone saying aye.
Aye.
Opposed, nay. All right, thank you very much. Okay, Lifeways, Mary Beth.
Good afternoon, Commissioners. So in your packet is this month's report relative to activities happening at Lifeways. Probably the major thing that you'll see that takes up the majority of the report is presenting, which our board just approved, is our strategic plan. We have 4 overarching goal areas, and they all align with the quadruple aim, which is really focused on better care, better health, better experience, and lower costs. So when you look at that, you'll see underneath each one of those goal areas strategic action items to move us in that direction. And some of those things we've talked about as well, right, relative to a big focus is around integrated health and moving the agency to align with especially Section 298's intent. So you'll see that in your report. The other thing that's included in your report is a summary of mental health trainings, both suicide trainings and mental health first aid trainings that are provided by Lifeways to the community. It's a major asset, I believe, to our community to continue to educate and reduce stigma. We are also partnering with Andy's Place and have an MOU agreement with Community Action Agency relative to providing mental health on-site services for the supportive housing initiative that they're trying to partner with. I'm pretty sure that you're probably all familiar with Andy's Place, so that's an exciting opportunity to help our community with the needs for those who struggle with substance use disorders. The other thing that's included in your packet is an update on Section 298. It is moving slowly, and the intent is for an October 1st, 2019 start date. What is occurring and should be released soon but has not been released is the department will be seeking a RFP for the management of individuals who are not part of a health plan. So there are individuals who have Medicaid who are not with a health plan. That's about 25% of the population. The state of Michigan is not going to give that population to the health plans. They are going to be procuring a PIHP to do so. So there should be shortly a RFP that releases that for that population. And then the other thing that's included in your packet is an update on the waiver. I'm anxious to hear we do have our state associations conference here in just a couple of weeks. We have been under an extension of our current waiver for the past 2.5 years. The state has been trying to pursue an 1115I waiver where they merge all of our children's waiver, HAB waiver, SED waiver, all into one waiver, and to expand integrated health efforts, but the Center for Medicaid has not approved that. So there is discussion about the state is going to be pursuing 2 other waivers, so I guess stay tuned. We're still on an extension with the Center for Medicaid at this point in time. And that is really it for my update. If there are questions of the county commissioners?
Dr. Thompson?
Hi.
Hello.
2 quick questions. With the, I think, could you refresh my memory in regards to you're trying to put a clinic or a health facility into the Center for Family Health?
Yes, we're partnering with the Center for Family Health to bring primary care within our psychiatric unit, yes.
Okay. So I explained this while you're adding on and so on to the townships and so on, and they asked the question, well, why are we doing that when we have the Center for Family Health? Okay, why are we duplicating the services?
Well, I would say that we're not necessarily duplicating the services because there's a group of population that we serve that are the chronically mentally ill, that are challenged with engaging in physical health care. And if we can embed physical health care within how we provide services, those individuals are going to get physical health care needs that they're not getting addressed now met.
Okay. And the second question was why was the Center for Medicaid, not approving the waivers? They give a reason.
It's a really complicated, and I don't know that I have a very clear answer from the state in regards to that. What I have heard is one of the things that they wanted to do with this 1115I waiver was to provide some supportive housing, and the way that it was structured was something that the CMS was not comfortable with. They kept going back and forth for the last 2.5 years, and I'm not intimately involved in those discussions, obviously, and just know what the state has informed us of, and that was something that CMS was struggling with, was the way it was proposed.
Okay. Thank you, Marcy.
Anything else? All right, thank you, Mary Beth.
All right, thank you.
afternoon, all.
Afternoon.
I'll cover some highlights in my monthly report to you. As I indicated kind of early on in the first page there, we do have an active shooter drill scheduled now at the Human Services Building, and our intention is that that will involve all of the other departments in the building as well. It'll be a coordinated effort, and there'll be lots of training and things that are provided beforehand to orient people to what these drills are like. And they can be pretty stressful. They're a bit challenging, but this is one of the items that we identified through our strategic planning process at the Health Department in terms of safety and security concerns identified by staff in the building. So we're scheduled for January 16th, and we're hoping we'll have a positive outcome from that, and staff will feel better about knowing what exactly they can do to protect themselves in the event that one of these unfortunate incidents happens. Sometimes we're lucky enough to be part of a class action lawsuit. We received a check for more than $5,000 in September as a result of a settlement with Stericycle, which is a medical waste disposal company. When I first got here, we started looking at contracts we had in place across the health department, and this was one of them I was quite concerned about because the amount of money that we were paying per year was right around $20,000, which I thought was exorbitant, and further investigation indicated that they had basically sold us a product that we never functionally used other than the waste disposal part. So they had built in the cost of providing kind of a robust training approach to medical waste disposal, which we didn't need, and we already had that covered in another way. So when the contract came up for renewal, we simply informed them, we had to give them a 6-month notification, we're planning not to renew the contract with them. When we did that, all of a sudden we had lots of communication about, wow, we can really do much better for you than what you're getting. And in the process, they really significantly reduced our disposal costs to probably roughly about, I would say maybe $1,200 to $1,500 a year. So that's a significant savings for us, and we were able to use those savings for other things that support public health in the community. But we're still at Stericycle today. There's always a lot of data that's out there in the community. We participate with community partners in looking at that data very closely. The Michigan Profile for Healthy Youth is one of those, and a number of us from the health department participated in an event in September related to learning more about what's in the data and what we can get out of it. And it really helps to inform us on these really critical areas of behavioral health, physical health, nutrition, and such that we are focused on as well with health action teams. We did have our biennial WIC management evaluation in September, and we really did quite well. I think we had maybe 2 or 3 items that were brought to our attention that we'll have to work through because we've had quite a bit of turnover in the WIC program. We were at a 50% new staff level when the management evaluation took place, and to have come out of it with 30 out of 33 I think is still very good. Across the state, and I think this is probably at least due simply to the economy, that most WIC programs are seeing a decrease in participation and an overall caseload, if you will. We've got some exciting news, though. We're up 1.5% in July, and I don't have numbers for August and September yet, but I'm hoping that we'll continue to trend upward again. So our staff did a great job. I included a copy of a press release in your packet today on life expectancy estimates that are available by neighborhood in Michigan. The way that this particular website works is basically if you plug in your actual street address, which is the way you get the best representation, if you will, on what the life expectancy might be in your particular neighborhood, it'll bring that up on the screen for you. And it does matter. Place matters where you live in every community. And depending on where you live, you may have more access to health care and specialty services than other people do, or simply more opportunity. And it's our intention to use this information to help us do better programming and reaching out to parts of the community that might have higher, or if you will, less life expectancy estimates than others. We did decide to apply for a grant from the Michigan Department of Health and Human Services. The cardiovascular health, nutrition, and physical activity section has made a $100,000 per year, 5-year grant opportunity available. Julie Weisbrod has been coordinating that with partners in the community, and the strategies that we identified are listed in my report there. More connecting sidewalks, paths, bicycle routes, public transit with homes, early care and education, schools, all those things that are part of existing master or community plans we can work on. We've already reached out to and are coordinating with the city of Jackson as well. So I won't go through and read everything that's in there, but I think you can see more or less what the grant committee wants to focus on. Julie works with a lot of different groups in the community, including the Elaine Circle of Trust, which is based in the Elaine apartment building downtown. We use them for lots of different purposes in terms of kind of not only trying to help them with individual health-related needs, but also utilizing this group to help inform us of what we're doing in public health that is most meaningful for them. So she helped them apply for a small grant through the Community Foundation, and they titled it Emergency Needs Closet / Residential Activities, which I'm thinking will be some health promotion-related activity as well, and we'll be the fiduciary for that small $400 grant. Dr. Mike Faust, our co-medical director, did make a nice presentation to about 30 primary care practitioners, if you will, back on September 19th. This was related to a primary care practice protocol for screening children for lead testing and follow-up, and he did a great job for us, and we're looking at the evaluations of that now. We're trying to also encourage more primary care practices to consider obtaining and placing a benchtop testing unit within their practices for capillary lead testing. These are almost instantaneous. Within 3 minutes, a provider will know, at least at a capillary screening level, what the level of lead might be in a child. So that's a positive thing that we're hoping more practices will do. It's a little less accurate than the venous blood test, probably plus or minus 2 micrograms per deciliter. So that's why we always, if we get a test of 5 or higher in a child, we normally initiate outreach to a family to offer lead case management services. But if it's 5 capillary, our policy is we want that confirmed by a blood lead, an actual venous. So to be more sure about it. I got a quick couple updates under personal preventive health services. Our MIP program, we're a contracted partner with United Healthcare Community Plan, and in September, we received a $125 bonus payment for achieving the items that are listed here in my report. Timely prenatal care consistent with HEDIS technical specifications, timely postpartum care, and also patients who received well child care consistent with HEDIS technical specifications as well. So we're glad to see that happen. Hepatitis A, kind of an update, I guess, on the overall outbreak in the state. The numbers of cases we're seeing per week now are declining. We're not out of the woods yet. We've still seen probably half a dozen cases or so each week since the summer, and they have been associated with the outbreak strain. We do continue to have vaccine available from the state for reaching out to high-risk populations, and we're continuing to do that. We actually had some money from the state that has run out now at the end of September, but if we still have staff time, energy, and resources to do it, and vaccine, we'll continue to reach out to the community to try to reach those people. So we've given 738 vaccinations to date since when this whole thing started, and we're seeing our vaccination rate, hepatitis A vaccination rate among adults has increased from 4% to 14%. The annual influenza vaccination campaign has kicked off. We've sent an email to every one county to let people know, and you can, a little change from last year, you can receive the vaccine through the health department through the end of January of next year. And part of our reason for wanting to do that is because influenza is quite variable in terms of when it peaks, and we'd rather have people continue to think that they can get the vaccine right through January rather than toward the end of each calendar year. In environmental health, we've done some health education, health promotion in conjunction with the governor's proclamation, a Septic Smart Week in the state of Michigan. And basically, it's just trying to encourage people to take a little more time and to do some inexpensive maintenance on their septic system so they can help them last a long time. One of the easiest things to do, I say easy, if you know where the lid is to pump your septic tank every 3 to 5 years. That's a general recommendation that people who have those systems should do. PFAS, PFOS update, as of September 25th, we had received results from 31 of 45 sample results in the community, and we have continued to have basically pretty much a non-detect status across most of those samples in Jackson County. We had 2 small municipal water supply systems test at a 3 part per trillion level, which is very much below the level of action, if you will, from a health perspective. And we're hoping that we'll get the results of all the test results from the vendor that's doing the sampling, hopefully by the end of October. I think they're a little bit delayed. We also had a response to a force main sewer break in Columbia Township toward the end of September. Don Haydick was very actively involved in helping support them with water sampling, both at the time of the event. Some of the drain that flows into Lake Columbia, some of the raw sewage from that force main got into that drain, and so there was concern about full body contact, if you will, by people in the Lake Columbia area. So we did issue a public health advisory and a notice that he distributed down at Lake Columbia to probably 50-some residents on the north end of the lake. Follow-up sampling indicates that everything is okay, and a lot of times nature self-attenuates these situations, so there's no longer a concern down there, and the leak has been fixed. That's pretty much everything I had for you today, and I'm happy to take any questions. Yes, sir.
Go ahead.
Just 2 questions. I had heard that this influenza season, that it's good to get 1 vaccination in the beginning and then 1 towards the middle or the end. Okay, is that true?
Well, I have heard some of that same comment being made. I haven't actually read it. I tend to use the CDC as the guidance for all of that kind of stuff, and maybe they've made that statement. I don't think it's unusual. If you got a flu shot now, I think it wouldn't be unusual to find less immunity by January of the next year. It doesn't hurt you to get 2 flu shots. If people have concerns about it, I'd encourage them to get another one.
So do you tell the people in the health department to tell people to come back in January and get a booster?
We will be happy to do that, yes.
Thank you.
Anything else? All right, Richard, thank you very much for your report. Richard?
Come here a minute. What were the two things?
Okay, committee, we're down to number D, the Administrative Controller Animal Shelter staff recommendation to be sent to the full board. If you looked at this, you'll see that it's filled with all kinds of information that we need as far as the functions of these positions, the requirements, criteria. Also shows minimum pay, maximum pay. It breaks it down quite thoroughly. Obviously, we have the administrator here, or Deborah, if you have any questions, but this motion will be looking for approval. As you can see there, creation and filling of new staffing positions at the animal shelter as a result of approved animal shelter millage to include 3 full-time animal control officers, 1 part-time veterinarian, 20 hours a week, 1 part-time veterinarian tech, 20 hours a week. That would be the motion that we'll be looking at. And again, like I said, all the information is there. Hopefully you've had a chance to look at it. And again, if you have any questions, Deborah's right there.
If I can interject, we had anticipated having the animal shelter operations manager come before the board this month with a presentation on the complete picture of what the millage funding would look like. However, with Jody's resignation, that's going to be changed a little bit. We're hoping to come back possibly in November or December, depending on when the new operations manager will be able to do that. So I just wanted to indicate that this is a partial staffing for the millage. We had indicated during the millage that we wanted to right-size the staff at the animal shelter. And we do anticipate that there would be additional needs, especially animal shelter attendant that helps clean the cages and take care of the animals and such. But we do want to ensure that the new operations manager has participation in interviews and all that type of thing in hiring this staff. So, but these positions are vital to the millage funds, and so we wanted to make sure that we get moving on these. And, but I just wanted to make sure it was clear that we will be coming back with the new operations manager as well for additional staffing. So this is a partial staffing from the millage.
All right, thank you for that. Anybody have any questions in regards to that? Everybody understand? Okay, well, you have the motion before you. I'll look for motion and support. We have a motion and support. Again, any further questions or comments? All those in favor, so we'll say an aye.
Aye.
Opposed, nay. All right, thank you very much. We are now down to claims. We need to move the claims to the full board. First and second, comments or questions on the claims? Hearing none, all those in favor, so we'll say an aye.
Aye.
Opposed, nay. Other minutes, I see no other minutes. Daniel? Okay. And we also are down to C, November reporting schedule, Department on Aging, Health Department, Medical Examiner, and Lifeways. And now, we're back to public comment. Public comment? Okay, no public comment. We're down now to committee member comment. Committee member comments? Nothing? Okay. It is 12:27, and we're adjourned at the call of the chair.